Hello, everybody. This is my thesis topic, investigating the accuracy of artificial intelligence used for caries diagnostic. My name is Bruna, I'm a dentist, and my supervisor is Martin Kivovic, and my SMS is Alex. My vision is making high-end dental diagnostics accessible to the public, and my mission is applying artificial intelligence to the community dentistry. Here we have our specific goals, investigating the accuracy of artificial intelligence used for approximal caries diagnostic, and investigating the accuracy of intraoral scanners used for approximal caries diagnostic. For the first goal, we are going to perform a systematic review with a meta-analysis. According to our background, the direct cost of dental caries is more than $200 billion a year, and the caries is still affecting people population, especially approximal caries. And considering bilingual radiography is a standard, to have a good accuracy can reduce the complex cases and avoid the teeth loss. As we can see on the image, it's not easy to check them at the first look. In addition, the literature shows disagreement between experts about caries diagnostics with a sensitivity range between 0.5 and 0.7. On the other hand, artificial intelligence can increase the early detection with a sensitivity ratio of about 0.85. So our aim is investigating the diagnostic accuracy of artificial intelligence for approximal caries lesions on bilingual radiographies. Our clinical question is, what's the accuracy of artificial intelligence used for approximal caries diagnostic on bilingual radiography? According to our PERD framework, as population, we have patients undergoing bilingual radiographies as index test, artificial intelligence, as reference test, experts' consensus, and as outcomes, the accuracy. Here we have our hypothesis with the clinical implication that artificial intelligence can increase dentist's diagnostic accuracy, especially for animal lesions, and avoid the teeth loss. Here you can see our systematic search, and we chose for the first domain bilingual radiographies, and for the second domain, caries lesions. According to our flowchart of selection, after the citation chaser, we had 15 articles, but since not all authors had answered our email regarding the missing data, we used 6 articles as quantitative data and 9 articles as descriptive data. Here you can see our final results, and we chose as outcomes the sensitivity, as we know, is regarding the true positives and can be calculated using this formula. We also chose the specificity, that is regarding the true negatives and can be calculated using this formula. Both outcomes are important to understand if the index test is equivalent to the reference test, considering the diagnostic capacity. And here we have 6 RCTs that evaluated artificial intelligence performance using experts' consensus as reference. And as we can see, the results favor artificial intelligence, and they are above the clinical threshold. Here we have the HS-ROC plot, and this is a hierarchical summary of the accuracy. And the accuracy is regarding the true answers and can be calculated using this formula. As we can see, most part of the studies were included in the confidence ratio, and the heterogeneity can be explained by 3 reasons. First, the sample size that affects the number of diagnostics. Second, the stage of learning that affects artificial intelligence decision-making. And third, the artificial intelligence model that we know one can be better than other. Here we have the study level table, and this is regarding the index test performance. And I would like to call your attention for the diagnostic odds ratio. And it can be calculated using this formula. Here we have two of our best results for the artificial intelligence performance. I also would like to call your attention for the prevalence. This is regarding the total number of caries found on the sample and can be calculated using this formula. Here we have three of our best results, and of course, they are the studies that use the real populations or sample size. As strengths, we would say this is the first meta-analysis about this topic. And as limitations, we would say the fuzzy gold standard, the low quality of reporting, and the lack of raw data. As conclusions, we would say the literature shows a discussion of a tendency for artificial intelligence to have high specificity and a lower sensitivity. And besides our outcomes are above the clinical threshold, the confidence intervals are still wide. So we would say the clinical implication is expert oversight is very important when using artificial intelligence for approximal caries diagnostics based on bite-to-wing radiographies. Here you can see our progress. And to our second goal, we are going to perform a systematic review and a meta-analysis as well. And according to our background, more than 500 million children still have dental caries. And the introduction of the intraoral scanners can support the clinical decision and avoid the teeth lost. And the process is very simple. The expert starts scanning the patient teeth, and where there are the mineralized tissues, there is more water, and the water reflects the infrared light of the scanner, resulting in a bright image with the shape of the lesion. That's why we can say intraoral scanners result in equal or improved sensitivity in comparison to bite-to-wing radiographies, as we can see on the numbers. So our aim is investigating the diagnostic accuracy of intraoral scanners for approximal caries lesions. Our clinical question is, what's the accuracy of intraoral scanners used for caries diagnostics? As population, we chose extracted teeth. As index test, we have intraoral scanners, and as reference test, we chose histological assessment, and as outcome, we chose diagnostic accuracy. You can see our hypothesis with the clinical implication that intraoral scanners can increase dentist's diagnostic accuracy and avoid the teeth lost. Here you can see our preliminary search, and we chose for the first domain intraoral scanners, and for the second one, caries lesions. Here you can see our 3 in vitro key articles, our progress, and according to our summary, we are going to submit the first article on May and the second one on September. And to finish my presentation, I would like to say Apollo Freire Scott. Education is an act of love, therefore an act of courage. You cannot fear the debate, the reality analysis. You can't escape the creative discussion, otherwise it will be a farce. Thank you so much.
Did you find any data about the DiagnoCam? Do you know the instrument, the DiagnoCam?
DiagnoCam is not our point here, but yes, when I was searching for dental scanners, intraoral scanners, I could see many articles about DiagnoCam.
Because maybe you can involve the DiagnoCam as a third option for the first or the second topic.
Yes, this is an alternative topic, but I would to highlight it's not the same of intraoral scanners, and sometimes it can be confused for the dentists and sometimes for the patients, but they are not the same.
I would have 2 questions. The first one is about artificial intelligence, maybe the type, like if it was the same for all 6 articles or if there is any difference. And second of all, you mentioned that you have 6 RCTs included. So maybe if you can give me some insight, what does RCT means here for the diagnostic accuracy? Thank you.
Thank you for your question, Petrona. The first one, yes, the studies used different artificial intelligence models, and as I told you, one can be better than other. Yes, it's correct. And the second point is the stage of learning. The studies use a different stage of learning to teach the task to the machine, and it really can affect the decision making of the artificial intelligence. And the second question, RCTs, in this case, I know this is sometimes confusing to understand, but we considered randomized studies, the studies that are used the randomized by twin radiographies. So if they are blind and masked, and if they are mixed, and if they really use a real form of randomized them, we call them randomized.
So every study which didn't use this randomization, you exclude it as an exclusion criterion?
They were included, but they are not RCTs, they are CTs only.
What do you think, what prevents the implementation of artificial intelligence in your clinical practice, the widespread implementation?
Oh, I think it will help us to have quickly detections. And in dentistry, it's very important for us because sometimes stress and the routine can affect the ability of understand if there is or not a caries in the teeth. So for me, it will really help us to detect caries, and as I show in the slides, we still have suffering with this problem in the population.
Are you planning on investigating only one type of intraoral scanners, or are you including many more?
Thank you for your question. And for now, this is only in the beginning. So for now, I say we don't plan anything yet. So my answer is not yet.
Was there any difference between the caries lesion severity in your first paper? How did you deal with that?
Oh, thank you for your question. We didn't evaluated the complexity of the cases, but the studies have shown, for example, the evaluation of the classification. For example, if the caries are in the beginning or if there are complex. So for us, it's important to understand because it's one more task for the machine, but we are not evaluating classification in our project. But yes, the study sometimes shows classification about the severity of the caries.
So one study, for example, could have mild cases, mild lesions, and then one study could have more severe lesions. Did that happen? There is a huge difference between the studies, for example, in the severity of the lesion?
I would say there is no difference of lesions, but I would say sometimes the artificial intelligence is more precise when detecting them.
Okay, because this could be a problem, just so you could pay attention. Maybe if you could see that better from the studies. Of course, it's a low number of studies, but I think that could be important as well, because this could impact a lot on how the diagnostic is being done. Okay, thank you.